Let me get my headband, guys. Oh, it's kind of low.
Yes, warm.
It's warm.
Warm hydrofacial headband.
Okay, wait. My edges. Oh. Okay. Push it back. All right. Okay. Feeling good.
Feeling good.
All right. Let me slide up.
All right.
We're ready.
Hi, everybody. So, I don't know who's watching today, but hello. This is Dr. McRae broadcasting from Your Best You Medical Spa. I'm here with the beautiful Simone.
Hello.
And she's been suffering with acne for many, many years. And she decided to come in and let me work on her skin. So what we're in the beginning of is what's going to be a 3-week series of treatments that she goes through in office where I target her acne concerns. So what I'm going to try to do is clear up her skin from current blemishes and issues that she has from long-standing acne, but also try to do some preventative measures so she doesn't continue to break out, as well as clear up some scarring that she has, excuse me, and get her complexion nice and uniform and clear. So Simone, thanks for coming in.
Thank you. I'm excited.
All right. Is there anything that, before we start or in anticipating coming in for this procedure or treatment, that you've been concerned about or worried about or had questions about?
Well, you really hit all of the marks.
Okay.
I mean, like you said, you know, having this problem for so long, and even though it's improved over the years, definitely still not where I know it could be or where I want to be. But it's about having somebody that I feel like I can trust, somebody that looks like me and knows, you know, that my skin is not like everybody else's skin. We're all, you know, really individual from that standpoint. So our treatment and how we treat ourselves should be individual as well. So I trust you completely,
Yay.
and I know your professional opinion is gonna get me right. So
Okay.
I'm excited.
Perfect. Yay! I'm definitely really excited.
Yes.
Few things that occurred behind the scenes. Simone and I have had many discussions about her skin and her current skincare regimen, things that she's using currently, as well as things that she's used in the past. We've talked about what she's used that's worked, things that haven't worked, because all of those things are part of her skincare history, her skincare journey. We've also talked about her health history, including things that she's allergic to, whether that's foods or environmental allergies. All of those things factor in. Simone is an avid exercise enthusiast, and she's actually a group fitness instructor, so she definitely eats right, tries to.
Yeah.
Eats right, works out, you know, drinks plenty of water, so, you know, she tries to do the things that she can in order to keep the largest organ in her body, or of her body, which is her skin, healthy and safe. So we're just going to continue to work on that. So Simone, what did you do to your face today?
Today I cleansed with it was just like a normal cleanser, no exfoliants or anything like that, from La Roche-Posay.
Okay.
And then just regular non-comedogenic moisturizer,
Okay.
And then sunscreen SPF on top of that. That's
Awesome.
it.
All right, great. And you did that this morning?
Yep.
Okay, and that's pretty much your usual regimen?
Mm-hmm.
Okay. When anybody comes in for any kind of treatment, I don't care if they just wash their face or they say they just washed their face 5 minutes before they walked in the door. The first thing we're going to do is we're going to wash her face. So, and also, questions, go ahead and put them in the chat. We are broadcasting on Instagram, Facebook, and YouTube simultaneously. So go ahead and put all your questions and everything, concerns, issues, etc. in the chat. I am going to be working. Simone is going to be getting work done. So we will do our best to answer all of those questions as soon as we are off of this live broadcast. But we will definitely answer them, okay? All right. So just to kind of keep you looped into what I'm doing, I have these sponges. I use different ones for everybody, brand new ones. Add water, and they basically inflate. And then I will moisten her skin, apply the cleanser, clean her face, and then we'll continue. And I'll tell you each step as we go along. So for this first part, I am using warm water to just do a surface, just kind of wipe down. And of course, someone will tell me if anything is uncomfortable, like the water temperature or if the sponges don't feel fine.
Feeling good.
What I'm using now is a gentle skin cleanser, also known as Foma Cleanse. I use a lot of Zeo Skin Health products, and that is the cleanser that I'm using right now. But I will be using a lot of different things during this broadcast, so I will tell you each item I'm using. And that's something that's really important to point out. There's no cocktail that is perfect for everyone. Everything needs to be customized. You can use a little bit of this or a little bit of that. It could work on me and then not work on Simone. So each person's different. I usually start though with anybody with a very gentle cleanser. Yes, it does smell good. Now, something that you'll notice for the camera angles that are really close up is I added a little bit of water in the bowl that I'm using that has the cleanser. You don't have to wash your face that way. You can just wet your face, wet your skin, and then apply the cleanser and it will automatically lather up. But for the purpose of getting this on camera and you being able to see it lather up, I did that. It's always best with any product that you're using to start with a little bit and then add more. Don't start with large amounts of product or cleansers when you're washing your own face. Basically, actually people say dime size, but you can really go with a little less than that. You don't want to put it in your palm. You want to use your fingertips. You will see me during this procedure use my palms. I have on gloves. If I had my bare hands, I wouldn't want to put things in my palm because that's a very dry area of the skin. It'll just absorb product and waste it. And product's expensive, so you don't want to waste it. Simone, when is the last time you had a facial?
Never.
Never!
Yeah, no, I'm trying to
Okay.
remember. No, never had a facial.
This is exciting.
I
I'm
know,
flattered.
first.
I did not know this.
Never had one. I've had a massage.
Okay.
Many a mani-pedi. Got my hair done plenty of times.
Yes.
Never had a facial.
Well,
So
this is so great.
yes.
And like I said, I am honored to be the person that does your first facial.
I'm excited. This is
You know, and it's so great because, yes, this is a medical grade facial. It is being utilized to treat certain skin conditions. However, it's still meant to be relaxing, something you enjoy, something that you want to come back and do. If you can heal and relax simultaneously, I think that's a great deal.
yeah.
All right. So, like I said, for that first step, what I did was I cleansed the top layer of the skin, removing any dirt and oil and dead skin cells. The next thing I'm going to do is apply a physical exfoliant. This is a Zeo Skin Health product as well. It's called exfoliating polish, and it's magnesium crystals. Again, got a lot of camera angles. So it is blue. And what I'm going to do is scoop a little bit out and then put it on her face. Alright, so what I usually do is I sweep it out with a tongue depressor. I'll apply it a few places, just kind of like this. And then I'll gently spread it. You do not have to rub this in. Be really harsh, apply a lot of pressure. The crystals do the work, okay? I will spread it out and then I will apply what's called a polish activator. And that will add an additional level of exfoliation. Okay? So there's the mechanical, the physical exfoliation that the crystals and the beads perform. And then there's the chemical exfoliation, which when I use the accelerator, that's that level of it. And with each part of this that I perform, we're going down a little bit deeper. The skin, the layers of the skin, about 6 millimeters, the epidermis specifically, about 6 millimeters thick. How does that feel, Simone?
Feels great.
Good.
It's warm. It's very warm. It feels good.
And I think this one also smells good. It's about, so the epidermis about 6 millimeters. You're trying to figure out what size that is. A pencil eraser. You measure pencil eraser about 6 millimeters. So when you do these type of facials and chemical peels with each different product that you use and each different technique, you're able to go down additional levels and levels that you aren't able to go to by simply just putting some soap on your face and then rinsing it off. Okay? So you'll see I spread out these crystals, rub them in a little bit, but not too aggressively. The next thing I'm going to do is pump out a little bit of this exfoliating polish activator. This is kind of a clear, maybe yellowish kind of substance, but hopefully you'll be able to see that as I spread it, the crystals dissolve. And Simone, it may feel a little warm, and if it does, it shouldn't feel uncomfortable, but if it does, let me know that too, because sometimes beauty is pain. Now this should not be painful, but everything is not super comfortable, but this should not be uncomfortable. And if you turn your head a little bit to the side, you can see it's forming kind of a lather where it's dissolving those crystals. Perfect. Thank you. What does this product feel like going on your skin, Simone? Can you describe it?
It feels like a gel. I can't see anything, so y'all know I'm not cheating.
Right.
It feels like a gel. It feels a little, it's definitely cooler than the crystals.
Okay.
So that's like a cool, like, we had a little warm, now we have a little coolness. It's refreshing.
Okay.
It smells like kind of citrusy. It feels clean, you know.
Okay.
Like, I like products that feel clean.
Yes.
You know, some of them, they do clean your skin, but
yeah, they feel terrible.
Right.
Some things feel terrible.
Yeah.
You will also notice that I use brushes a lot. I feel like I get really good coverage. I also feel like aesthetically it's a nice feel for the client. Just kind of it going over the fanning action feels a lot more gentle. And if you are someone who tends to be a little heavy-handed, you can usually have a lighter touch using a brush.
So,
Yes.
how often would you suggest, and I know it probably depends on your other aspects of your skincare, but how often should you be exfoliating? Like,
yes,
you don't do it too much, but also what's the right amount?
That's a great question. And so you honed in on the fact that everyone is different. That's true. There are going to be some people that feel like they just cannot tolerate exfoliation. That's just not correct. There are different types of exfoliants. You have some that are crystals, you have some that are liquids where you never feel kind of the rough texture. There are some chemical compounds where you apply those and they exfoliate. So once we've determined what your skin can tolerate, then we're able to really say, hey, this is how often you should do it. What you'll see thrown around quite often is about 2 to 3 times a week. But for some people, that can be too much. Some people only once a week. Some people can only tolerate it a few times a month. I exfoliate my skin about 5 days a week. But again, I've done a lot of things to my skin. Chemical peels, laser treatments, hydrofacials. You know, I have a pretty aggressive skincare regimen that includes retinols. So my skin can tolerate a little more.
Gotcha.
But that's a great question.
Well, that's the other thing, you know, I know when we talked before, just how obviously we're all changing all the time. So even like my acne struggles as a teenager, and the things that worked then or didn't work then might work now.
Right.
So that's something that, you know, could change as we progress
Yes.
with the treatments.
Yep, and that's an important point as well. No one likes to age, but it's happening. Period.
Yeah.
You know, you won't get yesterday back.
Mm-hmm.
You know, so age, race, genetics, the climate, where you live, environmental stressors, and again, I started with what you eat, what you drink, whether or not you exercise, how often you exercise, the type of exercise that you're doing. All of these things factor in to what your skin looks and feels like.
Mm-hmm.
So right now, what I dissolved on your face, I'm just kind of getting rid of the residual. But I'm sure you were able to feel that the crystals pretty much, you know, melted away. There'll be one or two, you know, 100 or whatever, but there were thousands. You know, this facial is called, because I didn't tell you what it's called. This one has a name. It's been branded the Oxygen Facial, and one of the main ingredients is actually benzol, as well as hydrogen peroxide. So it's deeply cleansing. And it's the one that I chose to start with because without even having known that Simone had never had a facial, this is her first treatment with me. And I did take a history. We did talk about what type of skincare products that she's used in the past. So based on that, I decided that on the list of the 3 that I plan to do, this one would be the gentlest and the best introduction to the series and, you know, her skin.
Baby steps.
Baby steps.
It feels so clean already.
Yes, it should. It should. And a majority of the facials that I do, they do fall in the category of a peel. Chemical peels can be light or superficial or topical. They can be medium depth and they can be deep. And that all depends on the depth of penetration of the products that you're using. So this is not quite a medium depth peel. You know, we're gonna get, like I said, epidermis 6 millimeters. We'll be at around 3. You know, which is fine, perfectly fine. Because what I don't want to happen is you to get home and have terrible dry patches, be itchy, uncomfortable. She won't be flaking for days, but your skin should continue to just feel light, airy, clean, clear.
Nice.
But because it is a type of peel, before you do any type of peel, you want to do a peel prep. Okay? So we cleansed, we exfoliated. The peel prep, I would describe it as kind of like your toner step to now prepare the skin to receive the next level of products that we're going to use. Okay?
Gotcha. It's like anything in life, you have to prepare to receive blessings and change and all that.
Absolutely. So, definitely tell the people what this smells and feels like, but in my opinion, it can be kind of funky. So, if you are able to break down exactly what, you know, funky smells like, feel free to let the people know.
I'll try.
There are peel preparation solutions that are pre-made, that are made by different companies. Again, this is a peel prep solution purchased from ZO Skin Health, but I could also prep her skin with 70% alcohol, or I could use acetone. This is what I've got, so this is what I'm using. I like it. It works. But if I ran out of it, I could use the other 2 things I named. Feeling okay?
Yeah.
Good. And so when your skin might start to feel a little bit dry, and that's what it's supposed to feel like. All right, what do you think that felt and smelled like? It's a hard one, right?
It's like, it does smell kind of like acetone or like a Sharpie. You know, you accidentally sniff a couple of Sharpies as a child. Had to learn the hard way, not supposed to do that.
Yeah.
Kind of like that. But it was quick. It also was kind of like menthol-y.
It's weird.
Like, kind of minty.
It's just not, for me, it's just not a smell that I would want to keep
It
smelling.
smells very, like, sterile.
Yeah.
So, that's comforting. Yes. I feel very, extremely clean.
Yes. Of the things we've done so far, I would say that's the thing that probably would feel the most sterile.
Right.
Okay. So, this mask that I'm about to apply is the oxygen mask. Okay, and I'll apply that in a thin layer. I'll let it dry for a few minutes. We'll be chatting, and maybe I may be able to look at one of these devices and take a few questions. Yeah. I don't know though, so we'll see. I mean, so if you've started putting them in there, keep on. If you haven't, now's a good time. We'll try.
The brush feels like little kitten licks, or like doggy kisses.
I love it. I love the descriptors. And it's also great to hear my clients, because I do many of these things to myself, but it goes a lot faster and a lot less relaxing. I'm definitely usually on a time limit. You notice around the jawline and ears, I do what's called feathering of the product, so that when you do treatments like this, you don't wind up with a line of demarcation, kind of like when you have on bad makeup or foundation, and this is one color and this is another. We don't want that. We don't love that. And so far, would you say anything about what we're doing, Simone, feels uncomfortable in any way?
No.
Okay.
I'm very relaxed.
Good.
Take a little nap.
And strangely enough, even though we're chatting, and most of my clients, we chat, we really talk, people are still able to be relaxed enough to actually kind of fade off, or, you know, just mellow out. And that's the type of place that I aimed to build. A place where you could come, relax, be yourself, you know, get your medical aesthetic needs met, you know, in a safe, welcoming, calm environment. There's usually music playing, but we did not want to get disconnected due to copyright infringements. And you never know what you're gonna hear. Also, it just kind of depends on my mood. Sometimes I'll let you pick, but not all the time.
Well, that just listening to you talk, it's like having on a podcast or something. It's perfect.
Depends on the topic, right? Sometimes it can get a little... All right, so I'm going to leave this mask on. I should have set a 2-minute timer in one of these drawers, but you know what? I'm just going to chit-chat you up a little bit. Take a look at the... Here, there you go. Alright, let's see what we got. If anybody said anything. I see people join. Oh, Stellar Styles. Brother Nash, thank you. Let's see. Again, whether it's Facebook or YouTube or Instagram, I appreciate you. You know, I actually can't get to one of the other cameras, so I don't know. What? I wish we had a call-in line during this part, you know, where you could just call in and ask your questions, because I can't see them. I'm technologically not great. But I'm glad to see we have so many viewers. So, okay, I'll just tell you what I'm going to do next. And I'll tell you about some other things that we've got going on. I mean, I got a timer. I got 2 minutes. That'll work. So, first of all, you can see this mask that I applied. It went on white and smooth. For the camera that's panned in the closest, you can actually see where the mask looks like it's starting to have patches that are fading. Okay? And that's because it's drying and sealing, tightening. The goal is to also, with this, stimulate collagen and elastin. So again, we want healthy skin, but we also want ageless skin. And again, say what you want. You know, people say, oh, I don't mind getting old. I don't mind having wrinkles. That's fine. But don't you want your skin to be healthy? Don't you want it to be bright and happy?
Mm-hmm.
So there's no reason that whatever number you are in your age, you should look whatever that is. And we're not going to do the thing where you start guessing how old I am, because at some point I'll announce it anyway. So you scroll back through any of the pages, you'll see it, because I usually party for about a month and a half, 2, 3. So so that was 2 minutes on that. It's going to be another layer, about 2 minutes, and then I'm going to put an activator on top of that, and then you'll get to see a little bit more kind of sizzle kind of thing.
Yes.
That's my professional, you know.
Yes. Sizzle,
term.
sizzle.
Yes, but what does it feel like, Simone?
It feels really light right now.
Good.
You know, airy, like a
Yeah.
cloud.
Good.
Mhm.
Good.
Which that's like, you know, a lot of, you know, like the clay masks or sheet masks that you
Mhm.
get from the store.
Mhm.
I feel like they're good, like, you know, just to do something and feel like you're having your self-care and, you know, but when they get all hard and
Right.
crackly.
I'm glad you mentioned that. Yes. I love a clay mask. They serve their purposes. However, they do get really hard, really uncomfortable, and if they are not removed properly, you can actually damage your skin.
Oh.
Okay, so again, we did not plan this. This is not scripted, but I'm glad you brought that up. Quite often, and I have no YouTubers in mind when I say this, but quite often, I see videos on YouTube of people doing clay masks, and then when the mask dries, they just start just kind of scraping it and rubbing it and just grabbing the product off of their skin. Absolutely not. Absolutely not. You're going to cause a level of inflammation and injury that completely defeats the purpose of you doing the mask to begin with. So any mask, especially that dries on like this, but very much so for the clay mask, use a moist, very moist towel. By the time you're up to taking it off, use cool water, not warm water, okay? When you're initially washing your face, when I did the cleansing and the exfoliation step, I used warm water. But when I go to take this off, I will use a cooler water, because now you're trying to cool down the reaction, the inflammatory reaction, the chemical reaction that you elicited at the beginning. So you basically do a controlled type of injury. You cause enough inflammation to get to the point where you generate good things, stimulate collagen and elastin, but you don't go past that point where you cause scarring. Again, defeating the purpose.
See, never knew that. Never knew that.
And we're on our 2 minutes, so this is the part where I try to look and see if we have questions, and I can't see anything, so I promise I'll look at the end. But we do have quite a few viewers. I'm loving that.
Yay.
Masks. I'm constantly asked what are my favorite kind of masks. I love natural. Again, I said I use retinol. So what? I want to have clear glass-like skin and maintain my youthful appearance. However, I love a clay mask. I like Moroccan clay, red clay. I like green clay. I like activated charcoal. Any of those, you just add a little bit of water. You could add a little vitamin C serum. You could add a little vitamin E, that kind of thing. Mix it up. Again, clean face, cleanser. And you don't have to use an exfoliant with that, because the mask is going to exfoliate. Cleanse, rinse, pat dry, apply the mask, leave it on 20-30 minutes, and take it off. Those masks I name, I do not recommend that you sleep in those overnight, because again, they can get really hard and be really abrasive.
So typically, I know, usually if I'm doing, you know, like an at-home mask, I'm not usually, because I'm from what I do know, not much, but
Yeah.
I'm not usually using like any actives or like retinol or anything
Sure.
like that afterward.
Mhm.
Is that right, or is it okay, or does it depend on the?
Sure. So let me break down the question. So when you're doing your at-home mask, and usually it's something with nothing active. And when she says that, no vitamin C, no retinol, no CE and folic, because you know we see that one a lot. None of that. Just kind of just your straightforward, kind of like I described with the clay. Those are deeply exfoliating. So once you do that, you definitely can apply a retinol if you want. However, I ask people to gauge their own skin sensitivity. If once you take the mask off, you feel like you're kind of red and tight and sore, don't add a retinol on top of that. Some of this is common sense. But if it's not, just call me.
Right. that sounds about right.
So now I'm going to apply another activator. Okay? So this is getting really foamy, sudsy.
I feel it.
Okay? And does it feel okay? What does it feel like?
It feels like a little bit warm.
Okay.
But like a good,
yeah,
like a nice little towel over your face.
Good. Perfect. And so now I'm going to activate this product. And so it turns it into another mask right on your face. Yeah, so I think you're going to be really pleased. Simone will definitely post pictures.
Yeah, I took some before pictures too.
Good.
This is what we mean when we say there's levels to this.
Yes, there are levels. And like I said, since I started low and we're going slow, I can do another facial on her next week. Okay? Now, we might put 2 weeks, maybe 3 weeks between 2 and 3 to see how the skin does, but we're on a good road. And I'm expecting definitely visible results. And I'm intentionally vague when I say simply visible instead of, oh yeah, all her acne will be gone, because if her acne did not show up in 45 minutes, it's not going to take a 45-minute facial to get rid of it or to clear up the scarring, right? So another thing that's required of you and me when we enter into this relationship is patience.
Patience.
So like I just described, I activated that mask. We're going to give it a few minutes again. More timers. Things like this, you know, you have to take your time. It's pointless to just put it on and then just wipe it back off. Let's give it some time to work. Different compounds have different time windows in which it's safe to leave them on or take them off. Like I said, this is a benzoyl peroxide and hydrogen peroxide based system, so the 2-minute intervals are significant. That's just enough time for me to see the reaction start and begin to stop, as well as for the client to feel a significant difference and also let me know if something feels uncomfortable. So once I take this mask off, I'm over here on the side for the people who can't see me. Sorry about that. Once I remove this mask, first of all, I'm going to use cold, cooler water, because again, now we want to start to shut this reaction down. We want to close those pores up. We're going to close them up to the point where they can receive certain things, like if in the next couple of days she's going to do vitamin C or anything like that, but that they're not so open all the way down deep where they can just fill with, again, dirt, oil, debris, and dead skin cells, again, defeating our purpose if we allow that. I'm so excited to see how many people have tuned in. And if you tuned in and had to leave, that's okay too. You will definitely be able to see the recordings, plural.
Every angle.
I feel like we might have lost one of our cameras.
Uh-oh.
I feel like Instagram says, would like to find and connect to devices.
Oh no, what did that?
Yeah. But that's okay.
Did it go away or is
Don't you guys love this part? Live and direct. It just says would like to find and connect to devices. Oh, allow. I'm so savvy. Okay. I fixed it, but I don't know when it gave up the fight. So sorry about that.
It's fine. Well, there's something
Good. And this is really nice. You're gonna love seeing this.
I can't wait to see it. I'm gonna go watch it. Pretty. Other pretty.
And then each layer that I put it on, I'm sure it kind of felt a little snug, a little tight, not uncomfortable.
Yeah.
But you'll notice that when I take it off, it just kind of feels soft and smooth. See how easily this is coming off? Smooth. You don't want to have to rub and rub and rub or drag anything across the skin to get a mask off. You should not have to do that.
True. No, it's like everything that I thought I knew about a mask is just going out the window. That's all right. That's why.
All right, it's right here. It's right here.
Exactly.
You know, and like I said, I'm eager to see comments, hear questions. There are always more than one way to skin a cat. So I'm sure I'm gonna have some people go, I don't use those sponges. I don't use those brushes. I wipe from left to right, and I mean that's fine. It's fine.
It all gets done.
Yeah.
All gets.
We're not gonna nitpick about those things.
Nah.
Good. And several areas where Simone had some kind of blackheads that hadn't come up yet, you'll see now where we kind of drill down and can see them. So you might have some eruptions over the next 24 to 40 hours. You just cleanse yourself with a gentle cleanser. Don't use an exfoliant. We have definitely exfoliated you. And that's good. That's good. We want it up and out.
Oh yeah, get on out. You gotta go home, but you can't stay here.
That's right. What she said.
I just feel so clean.
That is wonderful. I'm gonna put this towel over your face. It's not ice cold. It's just temperature's cooler than what we've been using. Does anything feel itchy, burny, stingy?
Nothing.
Okay.
Absolutely nothing.
Good. Alright. So now that I have cleansed, exfoliated, activated the exfoliation, prepped you for a peel, applied the peel, activated the peel, and then neutralized the peel, I will now apply your moisturizer and your sunscreen. Your moisturizer that I'm going to be using today is called Illuminating Ox Serum. It helps fight antioxidant stress, helps repair DNA. It is a Zeo Skin Health product. Many of you who are familiar with Zeo Skin Health are familiar with Daily Power Defense. That product and this product are very, very similar. This one gives you a nice little afterglow. Not like makeup, not like primer. It's just a little bit of a higher shine on it. And what we've done, it's a little abrasive, even though it doesn't feel like it. So it's okay to give you a little glow with it on the way out the door. There's nothing wrong with that.
I will not stop you.
Again, if I did not have on gloves, I would ask you to apply this product to your fingertips a little bit, but I'm about to squirt some out here, rub it into my hands, and rub it on her face. has a nice light
Mm-hmm.
feel to it. And like I said, it gives a little shine, but it doesn't have color.
Smells great too.
Feel good?
Mm-hmm.
Wonderful. And last thing I'm going to apply is an SPF 50 sunscreen. For the face, the best thing is an SPF 30 or higher.
I was just about to ask.
SPF 30 or higher. It is difficult when you have melanated skin to try to find a sunscreen that does not leave a cast. You know, you're going to have to kind of search around, do a little trial and error. But the most important thing that I want to tell you is when you have treatments like this, you want to use a physical sunscreen. So physical sunscreen, zinc, titanium oxide, anything that has a list of 5 to 10 ingredients in the beginning that you can't pronounce, those are chemical sunscreens. Physical sunscreen, zinc, titanium.
Gotcha.
All right. So I'm going to sit Simone up. She is all done.
Yay.
I really, really thank you for joining us. I thank her for coming in.
Thank
And
you.
like I said, we're going to take a look at any and all the questions. Bring her forward. Hopefully you'll still be able to see her on the camera. I don't know.
I don't know.
We got a lot of cameras in here.
Yeah. Like,
Is that good? What do you
Yep.
think?
I think
You want to come up more?
maybe a little bit.
Will they still be able to see you? Is the question.
We can adjust.
Okay.
Can you see me, people? Can you see me? Okay, I think I'm good. See me, people, see me. See me. See me.
All right. Well, thank you again for thanks for joining us. We're gonna do some before and after. I mean, we did before photos. We're gonna do some after photos. We'll take a look at all the questions and everything in the chat. Thank you so much, Simone.
Thank you.
Thank
this
you.
is wonderful.
I'm excited for what's to come.
Yes, me too.
All right. Thanks, everybody.
Thanks. Yay.
Oh.
okay,
Nice.
okay, okay.
Right.
Okay. Stop. Exit. Exit the live. Are you sure you want to stop in?
If you're still looking at us.